Hi, good afternoon. My name is Scott Chavers. I am an epidemiologist and I'm head of COVID-19 response for Mobile County Health Department. So I want to change things the way that we normally do them on our COVID-19 updates because of the press release that was issued by our governor, Governor Ivey, and the Alabama Department of Public Health. So today they have allowed institutions beginning January 18th to move into what is called phase 1B of the vaccination plan. So, what this essentially does is it opens up vaccine eligibility for individuals that are 75 years of age and older, as well as essential workers, which the first essential workers that are really being focused on right now are our police departments and our fire departments. So, this is a significant expansion of the eligibility in terms of those that can be vaccinated against COVID 19. There is now a process in place statewide that Mobile County will follow in terms of appointments for the COVID 19 vaccination. So, what this process will allow you to do is call a toll free number. There will be some questions asked of you by the call center to determine your eligibility, and then they are going to ask your geographic area and direct you to the closest available location to receive the COVID 19 vaccination. Now, again, this is starting January 18th, is when this will begin. Now, the number has been published, and they have just this morning received 338,000 calls. So when you call this number, please be patient. The call center is open 7 days a week from 8 a.m. to 5 p.m. So the number that you should call is 1-855 566 3333. That's 1-855 566 5333. Again, the last four digits, 5333. We have posted that on our Facebook as well as made this available to all the media outlets. So again, by governor decree and in conjunction with Alabama Department of Public Health, we are now allowed to move partially into phase 1B that opens up eligibility for vaccinations to individuals 75 years of age and older, as well as our first responders. So very excited there. We also need to remind everyone that 1A has not closed. So phase 1A was targeting our healthcare workers. We still have 326,000 healthcare workers in the state of Alabama, and we are moving through that population in terms of vaccination. So the phases, if you will remember, are based on an ethical review by CDC to determine those that are at highest risk for fatal and severe outcomes. Those are individuals in long-term care facilities, and those that are at highest risk for infection or death, and those are in the age group. For infection, that was in our healthcare providers. So that was 1A. 1A remains open, and then now we are opening partially phase 1B on January 18th, and we are using the 855 toll-free number that I just gave you, and that is available through our media outlets. Okay. Anything else, James, on that before
we posted that number in the comments?
Okay. So James just reminded me as well, the 855-566-5333 number is also in the comments of the Facebook live stream. All right, let me move on to what's happening in terms of the global pandemic. So worldwide, we're at 88,389,886 cases. In the U.S., we're at 21,644,000. We still lead the globally in terms of the number of cases. India falls behind us with less than half of that at 10,413,000, and Brazil is at 7.9 million. In the state of Alabama, through yesterday, we were at 394,287. When we look at mortality, we're at 1.9 million deaths due to COVID-19 globally. In the U.S., we're at 366,269. Brazil is second globally in terms of mortality at 200,498, followed by India. And then Mexico is at 131,031 deaths attributable to COVID-19. In the state of Alabama, we have surpassed the 5,000 mark. We are now at 5,191 deaths attributable to COVID-19. So when we look at our risk index for Mobile County, and Alabama Department of Public Health updates this every Friday, Mobile County continues to be in the high risk category. So that means that we are still getting elevations in terms of our daily cases, our hospitalizations, as well as our percent positivity. So our numbers are definitely not going in the correct direction or in the direction we would like to see them. When we look at Mobile County, in terms of our cumulative number of COVID-19 cases, we're at 28,176. That was an increase of 315 in the last 24 hours. If you look at our daily numbers as we publish in our daily report, you can see that there's some variation. And for instance, we were at 315 today. Yesterday, we were at 445 in terms of those that were being reported. But on average, we have been getting reports of between 300 and 400 on a daily basis. So these numbers are definitely, again, in the wrong direction in terms of what we would like to see. The fluctuations are occurring due to delays in lab reporting, and that, to be very frank, is in some of our urgent cares. They don't have time to report to us because they are so overwhelmed with their caseloads. Currently, we have to date received reports of 3,510 hospitalizations. That was an increase of 36 admissions in the last 24 hours, and we added 3 deaths to bring our total to 525. I think the critical number that we are looking at is the number of currently hospitalized. This number reflects the strain on our healthcare system, and not only lets us know what is happening with COVID-19, but also is interpreted in respect to your ability to find care. So whether you have cardiovascular disease or cancer or some of the other non-COVID related issues, when our hospitals are at capacity and COVID-19 is taking up half the ICU beds, it's difficult to respond in terms of handling increasing COVID-19 hospitalizations. The metric is not on hospital beds or ventilators as it was in the early part of the pandemic, but it's really on those that are there to take care of us when we get sick. And as these numbers continue to go up, it puts a strain on our nurses and our physicians trying to cover that. And so mortality, when we look at all-cause mortality and increases in specific causes of mortality, have all been increased in the COVID-19 era compared to what we would expect based on the averages over the last 5 years. So when we look at the numbers and look at the cases, we can almost to the day predict when we're going to get the spikes in hospitalizations and when we're going to see the increases in mortality. Right now, our hospitalizations are and our case results are a direct result of activities that occurred during the end of the year 2020 holiday period. So the die has been cast there, and we're going to live with the increased number of cases and the increase in hospitalizations, as well as the end result, which is the increases in mortality. What we continue to say is, although the vaccines are becoming more and more available, it is critical that you wear your mask, socially distance, stay home if you're sick, wash your hands, and continue to do things to bridge this gap between the time that we are currently in and where we want to be, which is that level of herd immunity to protect everyone. Okay. So I'll move on to our complaints that have been submitted. Remember, you can submit complaints that are directed at COVID-19 to covid19@mchd.org. What we typically do is we will contact the businesses or retail establishments and inform them, find out what they're doing, and work with them to educate them on what they can do better to reduce and to keep in place these mitigation activities. So again, that was 7 restaurants, 6 retail establishments, and 1 daycare. All right, so let me move on to the questions. The first question we received is, will Mobile soon be testing for the efficacy of herd immunity based on natural infection? So we actually do not test directly for herd immunity. So what herd immunity is, it's truly a theoretical concept of a number of individuals that have to be protected against the virus that causes COVID-19 in order for the spread essentially to be eliminated. And we are so far away from that the considerations of herd immunity at this time are premature. So vaccinations help us get there. As you well know, we are far below the 60 to 70 to 80% that are, in terms of population coverage, or the population that needs to be immune to reach this level of herd immunity. So we are by far not in a position to do that. We do monitor the percent positivity of the cases that come in. That number basically tells us, of the tests that are taken, how many are being reported positive. In our Monday expanded report, we had a percent positivity rate of 18%. When we look at our urgent cares, they are ranging in the neighborhood of 25 to 30%. The difference is individuals who are symptomatic and need to be tested quickly tend to go to the urgent cares, and that's why you see a higher percentage there versus the our numbers, which very often will include PCR numbers. Okay. So we had a question about hospitalizations. So as I reported, our number of hospitalizations in the last 24 hours did increase. We reported 245 today. That is a record for the number of hospitalizations since the beginning of the pandemic. So we are now beyond what was being reported during the late July, early August spikes. So again, directly attributable to family gatherings and gatherings that happened over the holiday period. Had some questions around the new variants of SARS-CoV-2 that is circulating. So just as a reminder, that's the virus that causes the disease COVID-19. We have seen 2 significant variants of this virus appear. One is in the UK and the other is from South Africa. We get changes in messenger RNA viruses all the time. They change almost every time they replicate. So again, another reason to wear your mask and socially distance. However, what's interesting about these variants is they were a major shift in the virus that affected the spike protein. The spike protein on the virus is that part of the virus that essentially opens the cell to allow the virus to enter your ACE2 receptors. These variants are now more infectious than the original strains observed in both the UK and South Africa, and they have become the predominant strains in these areas. So in the UK, the new variant is 80% of the isolates that they are tracking. I want to be clear on this. The current variants are still covered by the two vaccines, one from Moderna and one from Pfizer, according to the data that we have in hand. However, in terms of what we see with respect to viral mutation, we see it every year with seasonal influenza. You can mutate beyond what vaccines can cover. So it is imperative that we reduce the spread to reduce these major shifts in viral genetics. That's one of the ways we will conserve these vaccines. Okay. So I have a question now about are local doctors or hospitals using the COVID-19 antibody cocktail like the president was given. So there are some qualifications in terms of whether you qualify medically. I'm not talking about insurance, but just if you qualify medically to receive some of these treatments. But yes, they are available in all of our major hospitals that I am aware of. The antibody cocktail that is being used, which is a monoclonal antibody, so it's a laboratory developed, a little different than convalescent plasma in that it's safer to use, it's a cleaner use, is available here and is considered one of the treatments in the armamentarium of those that are hospitalized for COVID-19. So yes, I would encourage you to contact your healthcare provider on availability there. Next, we had a question about two of our graphs that we produce. These are specifically 4A and 4B. 4A is a graph that we show the number of cases based on laboratory reports. 4B reports the number of cases by week in terms of the infectivity, which is a modeling calculation that we use that basically determines when that person was actually infectious. So if we look at those two graphs, they do vary, and they can vary substantially depending on the circumstances. So 4A, which is by week of lab report, that is a graph that is influenced by laboratory delays and can be influenced by multiple things that skew the graphs. And you can see at points in time we add like 2,800 on a Sunday. That is based on lab reports. If we look at infectivity date, you'll see that the 4B smooths out in terms of you don't have these tremendous spikes on a given day. So both of those are informative to us. Infectivity, which is 4B, is a little more informative in terms of what the current state of the virus and transmissions are in terms of a more contemporary view. So one of the questions I got was sometimes they vary by 3,000 or 4,000. That is true. The difference in those two graphs is when we get these large boluses of cases that come from labs that are based on that lab date report as opposed to the actual infectivity date, that skews our numbers. And that can do that at a weekly or monthly time point, just depending on how many of these delayed lab reports are being submitted. So we get a lot of questions about vaccine availability. Thankfully today we did get answers and some more direction from Alabama Department of Public Health. That becomes clear in terms of, one, how you register for that. I will say also that there are going to be other opportunities for individuals to be vaccinated now that the vaccine availability is starting to increase. So, but in terms of eligibility, so I talked about 1A, I talked about 1B. So the next phase would be 1C, and 1C would be individuals that are 75 years of age and, basically 74 years of age and under with underlying health conditions. And that would go all the way down to where the vaccine is actually approved for use, which is at 16 for the Pfizer. So if you're 65 years of age and you have a heart condition or diabetes or obesity, then you would be eligible for 1B. When we moved from 1A to 1B, we the estimates are that we have essentially magnified the number of people by 14 times in terms of eligibility for coverage. So 1B is not going to, I'm sorry, 1C is not going to happen quickly. We still have to get through 1B. Then we have the question of the general population. So if I don't fit 1A, 1B, 1C, when can I expect the vaccine? Our current estimates are for April at the earliest. That is based on the anticipated availability of the AstraZeneca vaccine, which would basically give us 500 million doses for distribution. However, that vaccine is not going through the advisory committee or FDA approval under the Emergency Utilization Act. So April is best case for the general public to understand. All right, question about UV lights and if they are affected against, it says germs. So, but I'm assuming this is for COVID-19. So really, you need to be careful with this because there are all kinds of UV lights. There are specific lights that are used for decontaminating viruses from surfaces. That's what you need to be aware of. There are individuals that will promote different things in times of crisis that are not true. So be careful about what you're buying, and I would check actually if they're FDA approved for that use. Next question is, when will families of healthcare workers be able to get the vaccine? Again, that will depend on where you fit into the vaccine phases. Question, are there any plans to publish daily in total COVID vaccines administered? So right now, what Alabama Department of Public Health does is they do publish the number of vaccines that have been allocated to the state of Alabama and the number that have been administered. So I want to be very clear, though, that allocation does not mean that they're sitting in somebody's freezer here in the state of Alabama. That is the number of vaccines that have exactly that been allocated. It does not necessarily mean that they have been shipped by McKesson or by Pfizer to anyone in the state of Alabama. The turnaround time, because of the cold chain requirements of these vaccines, is very tight. So we basically know in about 48 hours time when we're going to get a vaccine shipment and the number that's in that vaccine shipment. So we had a question on why is Alabama fourth from the bottom in distribution compared to other states? So that's a very good question. If you look at some of the states around us, we are not at the same rate of vaccine actual distribution. What happened in Florida is when they made their order, they had, and I will also say in Tennessee and Louisiana, when they made their orders, they had so many individuals in phase 1A that declined the vaccine that they had overages. And so they did not want to waste vaccines, and they started administering into other phases so that vaccine essentially didn't spoil. So that's where we are with that. There was a vaccine distribution issue with Pfizer that occurred over the holidays that has been corrected. And so vaccines now are becoming more available for us in public health, as well as your healthcare providers, primarily the hospitals at this point, to do the administration. So next question is, how are these allocations determined? So we send in requests based on our needs. Alabama Department of Public Health reviews those and allocates that based on what our current use is and the vaccine availability at that point. All right, common question. So when will vaccines be available? We did that. Asking about the sign-up list. So the sign-up list is the 855 number that we gave out. In terms of who eventually will be giving vaccines, so as vaccines become more available, the distribution nodes for the vaccines will expand to include pharmacies. local healthcare providers, et cetera. The timing on that is kind of day to day with respect when they will come online. I need to be clear that you cannot just put these vaccines in a beer cooler. You have to have certain freezers that are available to cover the cold chain requirements of these. So that is another reason why some of this is slowed down a little bit. The other caveat here is our ultra low temperature freezers for Pfizer will not get warm enough to cover the Moderna vaccines because you burn up the compressors. So these are specific for that. Will Mobile County Health Department administer the vaccine to other healthcare workers outside Mobile County Health Department? Again, we encourage you to call the 855 number for direction on that. All right, did that one. All right, and then there's a question about who can you speak to discuss in more detail about the vaccine. So we've talked quite a bit in terms of vaccine safety. Two very, very safe vaccines. CDC published the rates of anaphylaxis. That's only occurring in 1 out of 90,000 vaccinations given. That in pharma is a extremely low number. And all of these have been medically managed, to my knowledge. We had two, I would say, hyperimmune reactions in the 500 that we gave. They were not anaphylaxis, but we were able to manage those quickly. It's very important when you fill out the intake paperwork to get your vaccination. If you've had any prior reaction to any other vaccine, to note that. If you carry an EpiPen, please note that. All that really means is we're going to watch you for 30 minutes instead of 15 minutes. The vast number of all vaccine reactogenicity episodes occur within that time period. Okay. But in terms of who you can ask, you can certainly send an email to our public information director. His information's on our website for any specific questions, or you can send them through Facebook. We are not doing any Facebook Live questions. Apologize for that today because they're not available. Our computers are not available for that, but we will continue to do that. I did want to note also, if you're viewing Facebook Live through another Facebook distribution channel that's not us, Mobile County Health Department, we won't see your questions because they go to a different site and we don't monitor those sites. Last question that I had was on influenza. People are wondering what's going on with influenza. Well, influenza rates are below what we would traditionally expect looking at historical data for Mobile County. So why is that? Well, if we look in the Southern Hemisphere, the Southern Hemisphere went through influenza and COVID at the same time. And many countries use the same mitigation activities that we do in terms of reducing COVID-19. That did result in a decrease in influenza episodes. We have also seen an increase in influenza vaccination rates. So wearing a mask and doing the other things, and really critical is the social distancing aspect, cuts down not on COVID-19, but things like your common cold, RSV, influenza, and other respiratory viruses. It's good for you to do this, not only for COVID-19, but other things. The other dynamic for influenza in Mobile County is that big peak that we see in January and February typically are related to the return of kids to in-class learning, which hasn't happened yet, so we haven't seen a spike, and also many of the activities around Mardi Gras. And it kind of depends on where Mardi Gras falls. So some of the events that are in place to mitigate COVID are also mitigating some of the other transmissions. It's interesting if I ask people how many colds have you had this year, common colds, that number is also down because of some of these mitigation activities. Okay, James, what did I miss?
Just go over the news release again.
Okay.
The phone number and the...
All right. James keeping me straight here. All right, so I just want to recap really the most important information of the day. So Governor Ivey, in collaboration with the Alabama Department of Public Health, has extended vaccine eligibility to components of the population who fall in 1B. Specifically, that is individuals that are 75 years of age and older and our first responders. So primarily our police and our fire departments. However, there are a large number of individuals that fit into that group. This becomes effective, not today, but January 18th. January 18th is when this goes into effect. So keep your eyes and ears out. The way that you sign up for an appointment to be vaccinated against COVID-19 is to dial 1-855-566-5333. You'll be connected to a phone center. They will get some information from you, determine your eligibility, and then schedule an appointment based on your geography to receive the COVID-19 vaccines. We have this information posted in our Facebook comments, and it's been made available to all the local media outlets. So I believe that covers it. Also, the call centers are open 7 days a week, 8 a.m. to 5 p.m. They've received over 338,000 calls as of this morning, so please be patient when you're doing that. They are open Saturdays and Sundays, so if you can get up Sunday at 8 a.m., make that phone call and get on the list. And again, there will be other opportunities for vaccination beyond what you're seeing here. So anyway, thank you very much. We'll return again Monday for our expanded COVID-19 report. Thank you very much.